So today I'll talk about hormone therapy. Hormone therapy is a type of cancer treatment that slows or stops the growth of those cancers that use the body's natural hormones to multiply. So how does it work? Hormones are natural chemicals in the body that control functions like growth and reproduction. Some cancer cells like breast cancers or prostate cancers have receptors that latch onto these hormones and use them to grow. So the main goal is hormone therapy should cut off this supply of hormones that the cancer is using. So there are some main types. One, blocking these hormones. So medications are used to block hormones from attaching to the cancer cells so the cancer cannot grow. Two, lowering the production. So there are some other medications that are used to stop the body from making these hormones in the first place. And three, removing the source. In some cases, a small surgery is performed to remove the organs that produce these hormones, like ovaries in women or testicles in men. So the primary targets are breast cancer and prostate cancer of hormone therapy, and for some ovarian or uterine cancers as well. It can be used before the surgery to shrink a tumor so it's easier to remove, or even after the surgery, taken for months or years to reduce the risk of cancer from returning. The benefits are, because this is a systemic treatment, that means the drug circulates through the bloodstream so they can reach cancer cells anywhere in the body. And second is that it's highly targeted, so it only affects cancers that are sensitive to hormones, making it a very personalized type of therapy. Today I'll talk about some very interesting phenomenon in hormone therapy. So the first one is the tumour flare phenomenon. So here what happens is, the patients first, when they start hormone therapy, they can experience a sudden temporary spike in tumor growth or bone pain. And this happens because certain hormone therapy drugs only initially, would stimulate the body's hormone production before permanently shutting it down. Now this initial flare of the hormone level is actually important because it shows that the cancer is sensitive to the hormone and it does require the hormone to grow. So later on, when the hormone is blocked or stopped from production, that is when the cancer cells starve. The second interesting phenomenon is the estrogen paradox, high dose estrogen therapy. So because estrogen fuels breast cancer, treating it involves blocking estrogen. But if a patient's breast cancer becomes completely resistant to anti-estrogen drugs, doctors sometimes use a very creative, radical move. They actually flood the body with high estrogen. So after years of being starved of estrogen, the cancer cells adapt to survive in a zero estrogen environment. Now the twist is, when suddenly bombarded with a massive amount of estrogen, the adapted cancer cells experience a toxic shock and undergo self-destruction. Today I'll speak about two more interesting phenomena in hormone therapy. So the first one is bipolar androgen therapy. This is similar to the one I spoke about yesterday, but this is for prostate cancer. So prostate cancer cells need testosterone to live. So therapy takes testosterone away completely from the patient's body. Now eventually the cancer learns to grow and adapt in a zero testosterone environment. So now shock injections are given. In bipolar androgen therapy, the doctors inject the patients with extremely high super physiological dose of testosterone. So with zero testosterone adapted cancer cells are hit with this massive wave of testosterone, it overwhelms their systems and cracks their DNA. So before the cancer cells can even mutate to get used to this high testosterone, the injection wears off and the levels crash back to zero. So this constant change keeps the cancer confused, and it resensitizes the cancer so that the standard hormone blocking drugs work effectively all over again. The second phenomenon is immune system weaponization, the hidden alarm. So when hormone therapy successfully blocks a cancer's fuel source, that is the hormone, the tumor cells enter a state of severe metabolic panic. And then there's an accidental flare. In their panic, these dying and stressed cancer cells release a distress signal called CXCL11 protein. While it's meant as an internal alarm, this protein behaves like a chemical beacon that leaks out into the body. And now the body's immune fighters, called the T cells, detect this and swarm directly into the center of the tumor. So now doctors are using this to combine hormone therapy with immunotherapy drugs, allowing the immune system to easily finish off the weakened tumor. So I've been talking about hormone therapy in cancer. Today I'll talk about the types of hormone therapy. 1. SERMs, selective estrogen receptor modulators. So these act like a shield on breast cancer cells and they block natural estrogen from locking in and feeding the tumor. 2. Aromatase inhibitors. These disable the enzymes that create estrogen after menopause. So this starves the remaining breast cancer cells of the fuel that they need. 3. SERDs, which is selective estrogen receptor degraders. So these bind to estrogen receptors and actively destroy them. So this deletes the docking ports so cells cannot receive growth signals. 4. LHRH agonists or antagonists. This stops the brain from signaling hormone production, so shuts down estrogen in the ovaries or testosterone in the testicles. 5. First generation anti-androgens. So these attach to testosterone receptors on prostate cancer cells and blocks male hormones from entering and sparking tumor growth. 6. Next generation androgen receptor inhibitors. These provide a much tighter, more aggressive block on testosterone. So this prevents any residual male hormone signals from reaching the cell nucleus. 7. CYP17 inhibitors. These block the specific enzyme needed to manufacture testosterone. So this shuts down the production in the adrenal glands and the tumor itself. 8. Progestins. This uses man-made progesterone to treat uterine cancers, directly counteracts and reverses the growth effects of estrogen. 9. Surgical ablation. Permanently removes the primary hormone producing organs, instantly stops production by removing of testicles or ovaries.